Is body dysmorphic disorder connected to the OCD spectrum? Imagine feeling obsessed with a tiny flaw in your appearance that no one else notices, and that obsession controls your life. This is what many people with body dysmorphic disorder experience. But is this condition linked to obsessive-compulsive disorder? The answer is yes, and the connection is well supported by scientific research. Body dysmorphic disorder is classified as an obsessive-compulsive and related disorder in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. This classification reflects the significant overlap in how the brain functions and how behaviors manifest in both conditions. Brain imaging studies show that both disorders involve abnormalities in the orbitofrontal cortex, a part of the brain involved in decision-making and evaluating risks. Both conditions also show abnormal activity in frontostriatal circuits, which are involved in controlling repetitive behaviors and thoughts. These similarities suggest that the underlying neurobiology of body dysmorphic disorder and obsessive-compulsive disorder is closely related. Further evidence comes from genetic studies. About 65% of the shared traits between body dysmorphic disorder and obsessive-compulsive disorder are explained by common genetic factors. This means that people who have one condition are more likely to have the other because of their shared genetic makeup. This genetic overlap supports the idea that body dysmorphic disorder belongs within the obsessive-compulsive spectrum. Behaviorally, both disorders follow a similar pattern. Obsessions lead to anxiety, which then triggers compulsive behaviors aimed at reducing that anxiety. In body dysmorphic disorder, the obsession revolves around perceived flaws in appearance. The compulsions often include mirror checking, comparing oneself to others, or seeking unnecessary cosmetic procedures. This cycle of obsession and compulsive action mirrors what is seen in obsessive-compulsive disorder, although the focus of the obsession differs. Despite these connections, it is important to recognize that body dysmorphic disorder and obsessive-compulsive disorder are distinct conditions. Treatment approaches vary because they respond differently to therapies. Obsessive-compulsive disorder often responds well to exposure and response prevention therapy, but this method is less effective for body dysmorphic disorder. Patients with body dysmorphic disorder tend to experience more depression, social withdrawal, and higher risks of suicidal thoughts. They may also have a broader spectrum of severity, from mild concerns to severe impairment that affects daily life. From a plastic surgery perspective, understanding this link is crucial for ethical practice. Many patients with body dysmorphic disorder seek cosmetic procedures to fix their perceived flaws. However, surgery usually does not address the underlying neurobiological causes of their distress. Performing cosmetic procedures on these patients without proper psychiatric evaluation can reinforce their preoccupations and may not improve their mental health. It is essential for plastic surgeons to screen for body dysmorphic disorder and refer patients to mental health professionals before considering elective surgery. Treatments like selective serotonin reuptake inhibitors and specialized cognitive behavioral therapy are often more effective in managing the disorder. In summary, body dysmorphic disorder is indeed connected to the obsessive-compulsive disorder spectrum through brain structure, genetics, and behavior. Recognizing this link helps ensure that patients receive appropriate mental health treatment rather than relying solely on cosmetic interventions. Always remember, the best care involves a team approach that prioritizes the patient's overall well-being and mental health. If you or someone you know struggles with body image concerns, consulting a healthcare professional is the safest and most effective step forward.